Hi, so we're going to show you how, if you come to the medical center, if you're appropriate to go to the respiratory assessment tent, what that process is going to look like. As you pull onto the campus, we're going to have this booth right here where there'll be a screener. They'll identify if you're here for respiratory related illness and if you're appropriate to go to the tent. If so, they're going to direct you to follow the signs, and we'll take you through that route. If you were here for other medical reasons or not appropriate for the tent, then they're going to direct you to the emergency department and enter in that way. So as you get back here to our respiratory assessment tent area, you're going to pull up and one of our staff members will greet you. What they're going to do is they're going to ask you to lower your window, to remain in your car, and they're going to give you a mask. Once you put the mask on, we're going to ask you your name, your date of birth, your phone number, and they're also going to ask if you're going to need any assistance getting in and out of the vehicle and into the tent. Once we obtain that information, we're going to ask you to park on the side, and then we'll call you when we're ready for you to come into the tent to register. If you need assistance, our staff members will come out and they'll get you and they'll bring you into the tent.
Once we call you to come into the tent, we ask that the patient and the patient alone come, have their ID and insurance information at the ready. If the patient is someone who is a minor and require an adult to accompany them, the adult may come with the patient. Both parties need to be wearing the mask at all times as they come into the tent. As you come into the tent, you'll be welcome to the registration area. The first thing you'll see is our hand sanitizer station. Make sure you make use of it. The registrars will call you to one of the available seats. You will sit down, give them your ID and insurance information, and they will then go through the process of registering you, creating a patient packet for you. Immediately after registration, you will be escorted over right across to the triage nurse. The triage nurse will use her clinical know-how and training to assess your condition. She'll take your vital signs. She'll also confer guidelines that have been established in cooperation with our emergency department. And she will make a determination as to whether you are a candidate for just going through the tent and be tested, or you are requiring more clinical intervention, in which case we have a team at the ready. She will just say the word. We would then escort you right to the emergency department, which is the building immediately behind the tent. Once the triage nurse has asked your questions, she will bring you over to this threshold right here, where once again we will wash our hands. There is a stop sign here because we do not want anybody to proceed unescorted beyond this point. At this point, one of our floor nurses will come in, grab your information, and escort you over to one of the open bays. Our nurse will escort you over into one of our bays. She would have you sit. She will then go over a series of questions to determine the length and severity of your symptoms and collect any additional clinical information that may be required. After that, she'll ask you to remain seated. She will exit the bay, then confer with one of our providers. One of our providers would then come into the bay and interview further, and then they make a determination whether they need to order a test for you or not. If you're not going to be tested, you will be given the reasons why, and they will give you the information as to what to do to follow up according to the CDC guidelines. If, on the other hand, they determine that you are a candidate for testing, they will inform you so, also give you those guidelines, and then they will exit the tent, write an order up. They would signal that you are ready to be tested, and then that information gets entered into our lab order entry system. There, the lab order person makes sure that they review all the information, or go over all the demographic information, label everything for your nurse, who's then going to come and take you to be tested. You will be escorted then to one of our 2 dedicated specimen collection stations. At this location, we would have specially trained nurse that will then perform the specimen collection. After which she will give you some additional instructions and then have you ready to go on your way. We then ask for you to stay in the room until then one of our other team members comes over and escorts you out of the tent.